Hello, welcome to the Woodford Physio. My name is Rick Porter. I'm a physical therapist, as you guys would call it, in the UK. And I joined your neck pain group just to understand better some of the symptoms that you guys were experiencing, some of your patient journeys. And then having read some of your questions and comments, I thought I might just put together a few little things, bits and tips and pieces. This is all completely free. You know, you are trying this of your own volition, but it's the kind of things that I experience being really beneficial in clinic. So I thought, I want to see what happens if I can share it with a wider audience. So, you know, I might see, 20 patients with neck pain a week, and they will get significant relief with this kind of thought process that I've come up with this movement program. So yeah, the first thing I wanted to start with is a little bit of just education around what my personal theory is, and then you can see how the program leans into that. So yeah, watch the next video for that. So firstly, I just wanted to come into some of the detail of the anatomy of the neck. So you can see here on my mate's skelly where all the joints are. You know, so we have the big joints in the middle, and then we have the little facet joints at the side. And you can see that the angle is kind of backwards and down. And when we get, rotation, you can see that these joints would slide over each other. When you bend your neck, they would open. When you straighten your neck, they would close slightly. And when you bend to one side, they close on one side and open on the other. And that's really important. But what I found is that the best way that we can decompress this area and create space is to think about the forces that act upon the neck. So if you think about gravity is the one consistent compressive force that we all experience, what we need to do is activate the anti-gravity muscles that lengthen, open up the spaces and decompress. Now, when you consider the shape of the neck there, that might be why, for some people, retractions are useful and some people they aren't. Because if I bring my neck backwards and I've got stiffness in the joint that retraction movement is mobilizing, then it'd be really useful. However, if I've got compression and retraction, what you find is that you just add compression in two directions, and it can be more painful than just doing nothing. So actually sometimes retractions themselves can be irritable. So we're going to start with the process of decompression and lifting. Now that is really, really challenging, if not impossible, in the presence of tension. So when we have tension within the body and within the neck, you find that the muscle is holding on tight, and then we're trying to move away from it. And what we want to do is allow this muscle to allow the movement, and this is how you lengthen and create space and decompress. So the first thing we're going to do is some breathing exercises to allow us to remove tension from the inside out. So what you're going to need is a small towel rolled up that's going to go underneath your head, and then a space where you can lie down. Now when you arrive here, the first thing you're going to do is get a sense of where does my body rest against the floor? Which part of me is making contact with the floor? I'm just scanning down. So my head obviously has some contact. I can feel it in my shoulders, the backs of my arms, my lower back, into my pelvis, the backs of my legs. But next I'm going to notice, is there a difference between the right side and the left side? We're not going to do anything with this. We're not going to try and fix anything. We're not going to try and correct anything. First, you've just got to be able to sense where the body is right now. And only when we can do that can we start to make changes. So once you've found that position and you've checked in with where I am meeting the floor, the next bit we're going to do is add some breaths. So the breathing exercises. The most important thing is that we imagine the thorax as one big space all the way down into the pelvis. One hand goes on your chest and one hand on your stomach. And you're just going to take some long, slow breaths. And again, this is an assessment to start off with. You're just noticing, does one hand move more than the other? Do they move at the same time? Do they fall as far as they rise? Once we've answered those questions, we can then move up to hands just on the top of the chest. Same thing, if I take a breath in here, now I'm moving my hands with my breath. Just seeing, does the right side move as far as the left side? Is it harder on one side compared to the other? And I come down to the sides of my ribcage. I'm going to breathe sideways now, so out to the side. Sideways and out to the side. And then relax. And come back to where we started. Breathe in. Both hands rise together, using your breath. Just let the air fall out. And ideally we follow this process for about 10 minutes, just working through different positions, sensing the breath in and the breath out, really focusing on not pushing air out. It's like a balloon. You fill it up, and when you want to let a balloon down, you just open the tap and let the air out. That's how I want you to experience your thorax, and think about the whole thing expanding, then just letting go. Once we've got that, we've removed the tension internally, and then we're going to add some movement. Okay, so now we've removed the tension from the inside out. We've now created the potential to move with less tension, which means we can experience decompression, anti-gravity, opposition forces. So the towel just gives a little bit of support to the neck. And the first thing we're going to do is take our neck the opposite direction that we want. So we're going to lift our chin, and that closes the space here. Now if this is uncomfortable, just go nice and light, don't go too far. And then we're going to slide nice and smooth and slow the opposite direction. So one more time. The chin lifts, and then we lengthen the back of the neck. Okay, so we've got the head slide, we've got the reduction in tension, and now we've got to add a little bit of gravity, because we've got to learn to manage it eventually. We can't live our lives on the floor. Now the way we do this is with the head slide but in sitting. So one hand is going to come to the back of your head, right to that top of that bony bit. Okay, one hand's going to rest on your forehead. So hopefully you've got a good view here. And the movement is the same. So I move this direction to experience closing, to then sense the opposite direction. Now I talk during this to give you an idea of the amount of effort and energy that I use. So it is very light, nice and easy. We're just getting the sense that the neck is rotating, the forehead's moving towards the chin, and the spaces here are increasing. We are decompressing, creating space and lengthening through the neck.